So we will explore concentration, the history, the medical overview, the philosophical implications, cultural and medical methods, and yeah. It was prepared by Max, but me and Kashi are gonna facilitate it. Um, I'll do my best, but I'm not very familiar with all the material yet. I'll try. So there is a history. Well, we know some uh, old uh, philosophers who were exploring concentration, and they defined it as, for example, Aristotle called concentration or attention a voluntary competition among percepts. And what it means is that um, it's it's an attempt to fight with different perceptions. So we have senses and we perceive things, and attention or concentration is the our attempt um, to direct um, our experience towards one of them. It's very hard to explain. And Stoic writers framed prosoche as a ethical exercise of continuous self-monitoring. So, what is prosoche? It is a practice that Stoic disciples practiced. It was prescribed by Epictetus, um, and they thought that constant attention is necessary to live according to nature. And focused they focused on um, their main aim in life was to excel and flourish, and also live in accordance with nature. And how Versace is connected to it. It is, well, I'm failing here. Let's move to the next one. I'm really bad at this one. I know a little bit more about eight limbs of yoga and dharana for sure. So, in Yoga Sutra 6, it defines dharana, which is concentration, as fixing the mind on a single locus. And in comparison to dhyana, which is unbroken stream of that focus, dharana is just trying to direct all your attention towards that supreme goal or your mantra. Um, and in recent explorations by scientists, it was discovered that concentration really um, changes the brain activity. So it's mentioned here that fMRI studies show frontal, midline, theta surges, and default modes suppression during the stages. So scientists find correlation with concentration and brain waves changes. in shamanic traditions, they use, to concentrate the mind, they use um, percussions or just rhythmic sounds that help to get into this state of flow, kind of narrow the external field of awareness and induce absorption, or kind of completely immerse yourself into the concentration process. And concentration was also discovered by, or introduced a little bit more by William James, the modern psychologist. And he defined attention as taking possession by the mind of one out of several possible objects, cementing the concept in experimental psychology. So he established experimental psychology. And another interesting thing is that we can compare different directions in psychology, such as behaviorism, cognitivism, constructivism, and connectivism. They all discovered the concentration or attention. And so behaviorism is mostly focused on exploring the person based on his actions that are not inside himself, but the ones that you can notice from the outside. And they kind of disregarded a little bit the inside motives of the person. In comparison, cognitivism is focused more on the thoughts, on what's going on inside the person, not only on his actions. Constructivism is a little bit more difficult one, but it's described as a learned interpretation of your perception. So learner builds on personal experience something, but he also actively absorbs the information from the outside world. So it's the combination of this internal learning process and additional information that comes from the outside. And in connectivism, it's more recent one, and it's kind of based on interpretation or on our personal experiences more, and the connections between different concepts that we build inside our minds, and they are considered as important as something that we can just notice from the outside. And I think that's it for now from me, and then I'll continue after Kashi covers medical overview of
Yep.
concentration.
So on a totally different note, I'll be going over the medical overview and the examinations that has been done to uh, like prove the consequences and the actuality of how concentration works through science, not just only by what our subjective perspective is on concentration and how we feel it different when we feel concentrated by, but more the physiological evidences that proves concentration to be the central faculty of our everyday life. So that there is a concept called the dual network architecture that is basically a measure uh, to show the changes that happens in brain and different parts of brain and the way they interact with each other when you concentrate. So the sustained attention tasks, the coactive dorsal and ventral, dorsal being the goal-oriented and ventral being the salience, uh, these are things that prove for concentration to exist on an evidence-based level. And the frontoparietal networks, dynamic coupling tracks, and moment-to-moment lapses. These are basically the tests and the measures. And as you can see in the that little picture, the scan of the brain that's been provided, you can see the changes from the different marked and colored labeled parts of brain after when concentration happens. As you can see in the first one or the second one, from right to left, you can see which parts of the brain by the test that's been entitled on top of them has been altered. Could you go to the next slide, please? Yeah, and here's a chart, the bold biomarkers of vigilance. Uh, basically, a uh, a body of examinations and uh, tests that are a measurement, a metric of concentration and vigilance. This image provided is not as simplified as it should be. It's very like sophisticated and clinical format. But if you zoom in just a little, you can see the different uh, the different names of the tests. The mean reaction time, the reaction time variability, the commission error rate, and the omission error rate. These numbers all define the level of concentration in a person. And yes, if you could zoom out just a bit. Thank you. Yeah. The rising global signal variance and altered functional connectivity predict waning vigilance in resting state scans, which basically is what I described as being the metric of vigilance and concentration. All right. The CPT-3 is again a a testified form of testing that's specifically designed for patients dealing with ADHD, which is the attention disorder, or could be the hyper also attention disorder. Uh, but mainly this also happens for people aged 8 and above, including adults. And it's a wide range of tests and tools used by clinicians and practitioners that quantifies lapses, impulsive errors, RT variability. Open access validation shows also the sensitivity to neurocognitive impairments, which, just to conclude, basically also shows the chemical structure of your brain, as well as the social aspects of your behavior, which are the impulsive errors and the lapses. So both the scientific, the chemical, and uh, the socio-behavioral aspects that test for if you have ADHD or not. So there are two concepts, the stimulants and the non-stimulants. Uh, Stereotypically, stimulants are known to facilitate and advance your concentration levels, which is to its core very wrong. Stimulants like coffee, uh, they, however, they do improve your psychomotor speed and accuracy with minimal effect on visual scanning, but they do not improve per se your concentration. It is merely uh, the the alteration that it makes to the makeup of your uh, neurotransmitters that makes you more vigilant. It's very temporarily, but not in any way permanently improves your concentration. So you can go to the next slide, please. Yes, the non-stimulants. Viloxazine XR rivals atomoxetine for total ADHD symptom reduction. Caffeine sharpens psychomotor vigilance in esports players and military tasks. So they do have an effect on uh, some factors of concentration, but concentration involves many activities and many processes that happen in your mind. So uh, drinking coffee or uh, injecting drugs in your body wouldn't increase your concentration, but only certain factors that is associated with concentration and with the improvement of concentration. So yes, you will not take coffee with the hopes of being more concentrated, but it does have some effects that is also comprised in concentration. And last but not least, the very most avant-garde uh, method of developing concentration is a neuromodulation and neurofeedback, which are still in their premature stages. But the cognitive training yields small to moderate working memory and vigilance, vigilance gains in older adults. Again, these are very uh, in their primitive stages, that for some people, also including some placebo effects, uh, have shown some improvements, uh, but not by all means. They do qualify as an evidence-based, uh, validated method of increasing concentration. There has been studies done, uh, but the results have been vastly different from each other, simply because the methods used in neurofeedback are, uh, I would say, quite yet subjective to each practitioner and each clinician. Uh, so again, the EEG neurofeedback shows medium to large sustained improvements with fewer side effects than medication. Just to clarify what neurofeedback is, it is aligning your abnormal brain waves, being the ones that stand out when you're anxious, when you're traumatized. Basically, those abnormal brain waves, per se, will be aligned with a more normal and standard brain wave. So basically, neurofeedback is through EEG they study your brain waves, and when you're anxious or when you're traumatized, by use of different methods, such as operator feedback, which is the method of reward and feedback. They they tell you, or they instruct you to do something, and if that thing works for anxiety, then they alter that brainwave through that standard brainwave. It's a very complex and, again, yet um, immature uh, way of treating uh, ADHD or disorders associated with concentration and focusing.
And so there are also some philosophical implications of concentration, and something to mention is that attention and consciousness get often confused, but these two are not the same things. Attention is more about the focus itself, where you direct your focus, and consciousness, it's more like a not as uh, discovered or proven thing. It's something still metaphysical. It's not very graspable by scientists yet. It's more like a state. Um, concentration can be looked at as something that we um, work on internally. So we do meditation, we do all the practices that help us to um, calm down our mind like naturally. And there is something that we can use externally, that we can add uh, to our routine, for example, to help us. Um, but I would say routine would be working on it internally, and external influence, it would be using medication or drugs or things similar to that. And also, we can try to see how we use our concentration, how we spend what we spend our concentration on. For example, if we have a limited amount of it during the day. So if we wake up in the morning and we first thing look at our phone and get the easy dopamine, we already expend a huge amount of our concentration in the morning, and then we feel exhausted by the end of the day, or not as involved in our life or in our work. So it's important to see and to assess um, what we can use our concentration for, what is useful, what is more purposeful or aligned with what we really want to do in life. And so we come to the next section, cultural and medical methods.
Yes. So, as uh, it is the purpose of the Thursday sessions. Mindfulness meditation actually finds its way in both the spiritual and scientific fields. And in both, we've seen some significant, over over thousands of years, effects on human brain. Uh, to start, for a beginner slash intermediate level, for 4 weeks, you can try the thrice weekly, or 3 times weekly, focus attention training, uh, which would result in improved uh, SART accuracy and the N2 ERP. We're not quite prepared with these terms. The slides have been handed to us in rather an untimely matter, but yes, uh, by mindful meditation, there has been study cases that uh, certify a remarkable improvement in these uh, scientific measurements that I've named, and we can see the slide. Yeah, please. Um, and what could be more important in our era than digital detox? And as Madhuvidya said, uh, digital devices can take up uh, a, a humongous amount of that capacity limit that you have on your concentration during the day, uh, because of how it demands us to concentrate on it. Some things demand less concentration to be done, and some things more. Digital devices are uh, most certainly up there to be the ones uh, of more demanding of one's focus and concentration. So, as a practice, you can try the 2 week mobile internet blocking, which would result in RCT, increased sustained attention, and subjective well being versus control. I personally find myself to be uh, way more active and animated, and just uh, of maybe less boredom with my other activities when I do a digital detox. And I've sort of needed it through my family. They are also on digital detox with me. And I find it to be of very high importance than other detoxes. Yeah. And this is the slide that confused me a bit, but the everyday practices uh, have some benefits, some meaning uh, quite an extensive number of benefits, but also risks. Uh, some practices could be the martial arts, calligraphy, rhythmic chanting, and dharana principles, and mindfulness meditation, as I said. However, the risks would be the push notification culture, the fragment focus, multitasking. Fragment focus is when you give special attention to small details of an entire whole, which means when you're reading a book, let's say, for example, you focus on maybe a chapter or two that uh, would lead you to uh, perhaps a lack of a full grasp in the whole idea of the book. And again, that, as Vidya mentioned, is a repercussion of uh, hyper focus and hyper attention that only lasts for its own capacity that is different from person to person, but it certainly can be increased through practices. And in conclusion, I can conclude only my parts, uh, and Marina, you can add to yours. Science, along with spirituality, proves concentration to be the central factor of our lives, especially uh, because part of the sociostructure is that you're valued by your knowledge. And when the grasp of your knowledge in your field of expertise uh, is uh, through concentration more refined and more elevated than other people, therefore uh, you would be ranked as one of the higher uh, hierarchies in society. And so uh, it also brings with itself the general well-being and satisfaction that you have with the things that you do. That when you concentrate in doing an activity that you love the most, you feel yourself to be completely absorbed by it and not distracted uh, or not diverged by um, different objects of distraction. And as you saw, also the medical testings of patients that were subject to practices that would increase concentration, which were quite helpful. And yes, that is for my part. Marina, if you want to add anything.
I would say you mentioned the most important parts. I would just want to share the sources. You can find them here in the last slide. And you can go and explore further.
Yep.
And if, well, we are three here. So if Nirmal has any questions, please don't ask the most complicated ones.
Well, that's a great presentation. Thank you so much. On the scientific ones, I had trouble concentrating on many of them, but it's interesting and a good entry point to start thinking about those issues with concentration. My friend who I'm meeting tomorrow actually has ADHD, and he's been relying heavily on the medication prescribed to him recently, and he saw a huge improvement in his concentration. I've been also struggling recently with it. I guess I'm quite restless, and I'm just looking at different factors that contribute to that. I'm thinking about the overstimulation and stress. I think this plays a huge part in all of this. Then there's too much external pressure to do and perform. Well, it can lead to burnout, which is due to extreme stress, just being overtired by different stimuli. And then naturally, those cleansing mechanisms, be it physical, like fasting, like eating only sentient food, or social, spending more time alone or with sentient people and less time with tamasic or dynamism or staticity based people focused on materialist and crude things more. I think it's key. Just wanted to share an example. Dada Parinirvananda came to live with me for 2 days, and he actually washed cleaned my fridge really big time. I was surprised. He cleaned it so nice. It was so just sparklingly shiny. And same thing with the sink. And I feel embarrassed, like I could never find. I could always find. I was always looking for like excuses. It's relatively clean. Like I'm not living in dirt or kind of like, but not as clean, not as pristine. And how a different people have different kind of sense of purity. and how difficult it is to do it, to achieve it, and how to maintain that. And I'm reminded of two books, and one of them I'm listening right now. I kind of discovered it, I don't think by chance. It's called Essentialism. It's the philosophy of getting rid of the non-essential and just keeping the essential, or similar to minimalism. And I'm trying to do that because I am notorious for over stimulating myself with different tasks and burning out like anything, like a candle. And it's an interesting book that forces you to focus just on what's important and leaving the rest be. This is what actually the art of meditation seems to be about. The first one is just to purify your mind. Even the preliminary pratyahara processes involve the three shuddhis, or the three purifications of the environment, of the body, and of the objective mind, of your imagination. So it's very interesting. The other book that another family acharya, family dada, who has a family, recommended me to read this book on the art of cleaning up. It's a Japanese book, basically how much it does, just the act of cleaning. It really helps to get rid of depression when you just physically clean the space, when you keep it clean, when you use water. So yeah, this is Shaocha, one of the yamas, right? One of the niyamas. Anyhow, these are very interesting things, and I'm very interested how focus or concentration have to do with this idea of cleanliness and purity, cleaning, getting rid of the non-essential things, and makes me a little bit upset because I'm cluttered with different things, and I feel like I barely can purify my mind. I'm barely finding enough time for my sadhana and sleep. I'm not doing as much as I want, as I wish I could do it, but at the same time, it is what it is. So, learning to let go of the non-essential and get rid of what's not necessary is definitely what I'm doing right now. Thanks. That was a great presentation.
Thank you for the comments.
I have to be finishing my paper right now, so I would like to go, but thank you so much for doing this. It's been great. You guys are doing a great job investing your energy, your time into this. I think it's great, amazing. Thank you, Max. Thank you to Max. Beat him my thanks for this. Well done.
You.
Namaskar.